Before we treat a person, of course, we got to make sure that we can test that person to the best of our ability. Accuracy and early treatment and early diagnosis is paramount to prevent spreading. Now, this is a collaborative effort. Right now, I think just days ago, there are only 12 centers in the United States equipped with the diagnostic tests. Soon, I think a majority of public health clinics, and hopefully down to primary care like myself, that we will have the ability to test. Now, testing is something that takes time to diagnose, is because you have to isolate the virus, you have to develop the test that's specific for that virus, that is no overlapping with other, let's say, mutant coronaviruses. After the correct diagnosis, then it's the speed of recalling the patient. Can you call the patient right away and say, you have the coronavirus? If you can't get hold of them because they ran off, they're doing their chores, they go on a trip, they're celebrating something because they just had a wedding, we don't know. Now, so you need the collaboration between the patient and you, the doctor, and you at home, who you come in contact with. So there are lots of things that is interrelated that as the general public we don't think of. Now, there are other vaccines available for other treatments like influenza. The vaccine itself changes in this antigen, which is the most virulent virus for the year in the influenza vaccine. But coronavirus, we don't have one. So what do? So you start from the scratch. So you isolate the virus, you get something that I can identify that virus and attack that virus, and then after you go through those steps, if you are successful, then you do tests. So you do it on animals to see if it works on them. Then if they are good, no side effects or acceptable side effects, then you do it on a group of human beings. And after the human beings are successful, then you have to manufacture this as a vaccine. And then you disseminate these vaccines worldwide. Now, the total time from beginning to end can take 18 months or even longer. This coronavirus can also in time mutate, meaning you say it's like they're changing their hats, from a green hat to a red hat, so that they can still infect other people with a different hat. And you have to go away knowing that 79% of people infected with this virus, coronavirus, will become better. Only 3% so far that we know of mortality, people dying from this. And they're usually older people. So I think you should know that to keep yourself healthy is another point that you should be very cognizant about. Is that don't put yourself at risk. If you have diabetes, get that under control. You have not had any protection against influenza or any hepatitis or any shots against pneumonia. Get those things done. This is the time to protect yourself.